Dr. Peter Hotez is the co-director of the Center for Vaccine Development at Texas Children's Hospital. He joins us from Los Angeles. Dr. Hotez, welcome to the show.
Thanks so much for having me.
So President Biden says the U.S. is closer than ever to declaring our independence from a deadly virus. But when you look at the numbers, the administration wasn't able to hit its July 4th target for vaccinations, and just 20 states have reached that goal to partially vaccinate 70% of American adults. What's the problem in the U.S. right now? What's the biggest roadblock?
Well, the biggest roadblock is we have actually two problems. One, we have pockets in this country where vaccination rates are extremely low, particularly in the southern part of the U.S., Missouri, Arkansas, and then going into the deep south, Louisiana, Mississippi, some of the mountain states. That's problem number one. Problem number two is now we have the rise of the Delta variant. And wherever there's overlap, meaning high rates of the Delta variant that comprise a predominant amount of the virus that's still circulating, plus low vaccination rates, that's when you see the big uptick. So, for instance, the worst affected part of the country right now is Missouri. 53% of the virus isolates are the Delta variant, according to the Scripps Institute for Research, and then a very low percentage of southern Missouri especially is vaccinated. And guess what? No surprise, we're seeing lots of people go into intensive care units in southwestern Missouri and elsewhere.
You know, you look at some of the data, it seems that these pockets of resistance you're talking about, they're white, they're rural, they're conservative. And you've had such a head start and such an overabundance of vaccines. So why is it so hard to break through with some of these particular groups?
Yeah, what's happened is a segment of the U.S. population has tied their political allegiance or their ideologies to not getting vaccinated. It's incredibly self-defeating, but there it is. It's the same groups that were defiant of masks and social distancing in 2020. Now they're defiant of vaccines, and they're on social media buying into all of the anti-vaccine disinformation as well. So it's quite a toxic mix, unfortunately.
You know, currently in the U.S., the vaccines only have emergency approval. It's kind of similar to the situation here in Canada. Is the hesitancy simply political and ideological, or would giving this full approval from the FDA, would that help ease some of the hesitancy?
Yeah, I mean, the FDA worked really hard to closely approximate the full approval process through emergency use, and it's likely the vaccines will be approved very soon. I think it's a bit of a straw man. I think even after the vaccines are approved, they'll come up with something else. So this has been this kind of Pyrrhic game of vaccine whack-a-mole, where you knock down one of the myths and then another one pops up. It's been ongoing since the beginning of the pandemic.
So what's best case scenario? I mean, what sort of a percentage of the U.S. population do you see getting vaccinated? I mean, I know it varies. The Northeast is way ahead of the Deep South, as you're talking about, but like overall, where do you think the U.S. can get to?
Well, ideally, if we can get to levels in Massachusetts, the levels that we're at in Massachusetts and Vermont for the entire nation, that would be pretty good. If we can get, 70, 80% fully vaccinated by the summer, and that's how we'll get around the Delta variant. If we don't do that, the Delta variant will continue to circulate, and predominantly young adults who are the ones being most defiant, and some of the adolescents and their adolescent kids, they're the ones who will get sick with long-haul COVID. Maybe not necessarily dying from COVID, although that will happen too, but severe illness and then long-haul COVID.
You know, we've seen some areas bring back the mask guidance. Dr. Fauci has said even fully vaccinated people in areas of low vaccination should wear masks. Is that a viable solution for the United States at this point? It seems like a lot of people mentally and politically have just moved past masks.
Yeah, the problem is the places where we may need people to mask are the places where people won't mask. So again, in the southern states where there is this defiance, and I would say it's not just a matter of states with low vaccination. States like Missouri have low vaccination and high levels of Delta. It's that 1-2 punch where you might want to be inside and still consider vaccinating.
You know, I look at the Delta variant and we look at the low rates of vaccination, but you've had extremely high cases of COVID, particularly during the early parts of this epidemic. Can that natural immunity from people who are sick and recovered, does that offer any protection to the population, or does Delta just change the game so entirely?
It appears to offer some protection, but remember, it's very variable. So if you become infected with COVID and then recover, the level of protective immunity you'll have and the durability is extremely variable. Some association with severity of infection. So if you get light infection, then you have lower levels of virus neutralizing antibody and not very long lasting protection. So even if you've been infected, now there's studies showing if you get vaccinated on top of that, you get much more durable and robust protection against the variants.
So if you're Canada, I mean, we're close to 80% of the adult population having at least one shot and over 40% now having full vaccination. There's a lot of pressure economically and politically to open border restrictions and allow the freer flow of travel between Canada and the United States. If you were the Canadian government, how comfortable would you be loosening the travel restrictions with the Canada-US border given the state of play in your country right now?
Well, I'm a believer that travel restrictions are not very effective. I mean, at the beginning of this pandemic in 2020, we put a lot of emphasis on travel restrictions from China. Meanwhile, the virus entered in from Southern Europe and caused that first wave in New York City. So I don't think they're very effective. But here's the more important message for Canada. Canada has put a lot of emphasis on single-dose vaccination strategy in order to get everybody a single dose, and then figure out the second dose after that. And ordinarily that made some sense. The problem is this. With the Delta variant, a single dose of immunization with, at least for everything we can see, is not very protective against the Delta variant. So I think all hands on deck for Canada has to be on getting everybody fully vaccinated as quickly as possible. That's the only way they're going to be fully protected against this Delta variant, and that's where the emphasis has to be. And I actually think travel restrictions, all the other stuff, tends to be a distraction more than being helpful.
Well, Canada's doing a little over 1% of the population a day getting that second dose is where it is right now. So by the end of July, for example, I think we'll have about 75% fully vaccinated. That's the rollover point for border restrictions. So should people have comfort if they were to open it up then, knowing that you're a bit agnostic on the value of border restrictions in the first place? I mean, public confidence is a big part of public health, right?
Yeah, I just don't think border restrictions work. So, and that's fine if they want to use that as a benchmark for opening up the borders. I don't have a problem with that. But the key, the overwhelming emphasis is to work as hard as you can to fully vaccinate Canada with those 2 doses. It's really paramount if you're going to offer protection against Delta.
Okay, Dr. Hotez, thank you so much for your time.
Thanks so much.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.